Hi guys, welcome to Plastic Surgeon Vlog. In this video, we will understand what is incisional hernia. So if you split this word incisional hernia, so incision means when the surgeon cut your body for the operation, this is known as incision, and when hernia develops in this part, this is known as hernia. So incisional hernia is the development of hernia at the site of previous surgical scar. So for the development of the hernia, there are three factors works together. One is surgeon factor, second is patient factor, and third one is environmental factor. So if we discuss surgeon's factor, so surgeon factor is like faulty technique in the suturing. Means surgeon is having some faulty technique while closing your wound or just suturing your wound. So because of that, there is looseness of the sutures, and then the gapping occurs in the post-operative period and patient develop hernia. But this surgical technique, because it's very less common, so we are not discussing it in detail, and that is not of your part. So because of that, I am skipping this. Second factor is development for the development of hernia. The patient factor means patients like own factors are acting here for the development of the hernia. So in the first factor, immediately after the surgery, you start coughing. So because of the coughing, you are putting extra pressure on your abdomen. Because of that, you may loosen your suture. So suppose I'm coughing. So by the time that will separate and my wound is separate and causes development of the hernia. So excessive coughing. Second factor, when you're going for the motion, you are applying too much pressure. Because of that, your wounds are gapping. So you are having constipation, you are having prostate problems. Because of that, you might develop hernia because of excessive abdominal pressure. Third thing is when you are smoking, you are having excessive tobacco chewing, and you are having alcoholism, you are having some micronutrient deficiency. So because of that, your tissue quality is poor and you are prone for the development of the hernia. Then another factor is that you start heavy weight lifting immediately after the surgery or just 1 or 2 months after the surgery. Don't do it, because normally that wound strength takes at least 1 year to return to normal. It's never returned to normal. It becomes 90% of the normal. So generally we used to give patient this advice that don't lift heavy weight, don't do heavy exercise, don't do like abdominal pressure increasement maneuver for at least 3 to 6 months. And the fourth factor, patient do not apply the belt which surgeon gives them in the post-operative period, because if they are not applying belt over the abdomen part, so in that case definitely there is chance of development of hernia, because whatever they are doing, it will lead to the increase in the abdominal pressure and development of the hernia. So these are the patient factor. If we see environmental factor, which is the third factor, so in that case, if suppose this is my surgical incision, although surgical incision is on the abdomen and there it leads to the development of the hernia, but suppose this is my surgical incision and I'm touching it regularly, and this is just 7th day after the surgery. So because of excessive touching or because of some contaminated dressing, and I'm not doing proper cleaning, because of that I might develop infection in the wound. In that case, because of infection, the wound will gap and lead to development of hernia. So this is the environmental factor implicated in the development of hernia. So all these are the basic factors. Now question comes, what you can do at your level to prevent the hernia. So suppose someone has undergone surgery. So give him advice to wear belt, give him advice not to do smoking, give him advice not to lift heavy weight for at least 6 months, and give him advice for the proper cleaning of the wound and not to touch it regularly, and give him advice for the regular follow-up for at least 6 months, so that you can see how much strength in the wound is there. So by giving these advice, you can definitely prevent the development of the hernia. So this is all about the hernia, and I hope you like this video. If you like this video, please subscribe to this channel. In case you have anything, you can put in the comment section. And yes, thanks for watching it. Have a nice day. Bye bye.